Hey, my name's Morgan, and today I'm going to be demonstrating how to change a central line dressing, how to access, deaccess, and how to give medicine through it. So here is my work area. There is nothing behind me. So before I do anything with my patient, I always want to check the doctor's orders to make sure that that's what we're supposed to be doing. Before I go into the room, I want to gather my supplies and I want to check the expiration date on it. I also want to adhere to general safety practices. I want to provide for privacy for my patient. I'm going to explain the procedure to the patient and tell them what I'm going to be doing. And you always want to identify your patient and check their armband, their name, and their birthday. So before I go into the room, I want to make sure I have on my proper PPE, my gown, my mask, and because we're so close to the heart and important organs, we want to make sure that we reduce the amount of bacteria and infection as much as possible. So I've got my mask on, my gloves, my gown. I'm going to perform hand hygiene. I'm going to ask the patient to put on a mask as well. If there's any visitors or family members in the room, we can ask them to put on a mask, or we can ask them to step out while we're changing their dressing. We can also have the patient turn their head to the opposite side that we're working on, so that they don't breathe directly into the site, because it's such an important site to keep clean. So we've gave them a mask. I'm going to perform hand hygiene. I'm going to put on my clean gloves. And then you always want to make sure that the area you're working with is clean. So I could clean this with like a disinfectant wipe before I started. So first we're going to take this old dressing off, and we're going to start from the outside, go to the center, and make sure not to touch the center of the side. So now that we've got this old dressing off, we want to inspect the site for any signs of infection or irritation, or any drainage that's abnormal, because that could be a sign of infection as well. And we want to document that and let the doctor know. You can also check for placement. Sometimes there's these little dots that are coming out on the line. You can count those and then confirm it with what was previously charted. If it's anything any different, you can get a order from the doctor to get a chest x-ray and then confirm placement. And then, of course, you wouldn't want to put anything through it until that's confirmed. So we're going to dispose of this old dressing in our gloves. And now we're ready to set up our sterile field, so I'm going to perform hand hygiene again. I checked this, the expiration date on my supplies. Make sure not to touch anything but the outer 1 inch. Okay. So we are going to put on our sterile gloves. And make sure not to cross your sterile field. Make sure to only touch the inside of your glove if possible. Okay, so we can dispose of this. Alright, so now we're ready to clean the sock. And together our alcohol swab. And we're going to clean the center of the sock first. I'm going to clean this for at least 30 seconds. And we go from the center to the outside and make sure not to go back to the center because we've already cleaned there. Make sure you clean all around. So we're going to dispose of that. And then make sure not to put it on the center of your sterile field. So we're going to dispose of this in the trash. So then we're going to apply skin prep around the area. Just don't put it anywhere near the center of the side. We're going to dispose of that. And then we're going to apply our bio patch. And this goes right in the center. Okay, and then we are ready to put our dressing on. You want to make sure that it is in the center of the sock. And after we place it, we want to label it with the date, the time, and our initials. So, now that we are done with the sterile part, we can dispose of our sterile field. But we also want to make sure that we change these clays. So these need to be changed at least every 7 days, or you can change them if just as needed, or when you're changing your dressing. So to do that, we want to get a new clay. We're going to leave it in the package. We're going to gather our saline. And we're going to attach it in here. We're going to leave it in the package until we're ready to use it. So you would change all 3 of these the same way. We want to get an alcohol pad. And we're going to take this old one off. I'm going to clean the port vigorously for 15 to 30 seconds. And we're going to attach the new one. So you want to aspirate to check for blood return. You can aspirate 3 to 5 milliliters of blood, and then you want to flush it. And then we're going to apply a Puros cap to the end of this. We want to do that for all 3. So we've done that, and we're going to dispose of our stuff. And then we will access and deaccess the port next.